नमस्कार, मेरा नाम अदिति है। मैं यहाँ होप फाउंडेशन में एज अ एडमिशन काउंसलर काम कर रही हूँ। 10th पास के बाद अगर आप कोई स्किल एक्वायर करके अपने लिए जॉब सिक्योर करना चाहते हैं तो आप यहाँ पे हमारे साथ जुड़ सकते हैं। यहाँ पे हम लोग 3 तरह के कोर्स कराते हैं। पहला नर्सिंग असिस्टेंट, दूसरा रिटेल मैनेजमेंट एंड तीसरा हॉस्पिटलिटी एंड टूरिज्म मैनेजमेंट।
मैं होप फाउंडेशन में 3 मंथ फ्री कोर्स जीडीए का करने आई थी, जनरल ड्यूटी असिस्टेंट, जिसमें मैंने फ्री कोर्स 3 मंथ का कर लिया, जिससे मुझे शिफास मेलन हेल्थ केयर में பிளேஸ்மெண்ட் हुआ है. இப்போ எங்களுக்கு இன்டர்ன்ஷிப் வந்து ஷிஃபா மெலன் ஹெல்த் கேர்ல கிடைச்சிருக்கு. இதுக்கப்புறம் அங்கேயே எங்களுக்கு பிளேஸ்மெண்ட் ஆயிரும். இப்போ எங்களோட ஜாபும் அங்கே கன்ஃபார்ம் ஆயிடுச்சு. எங்களுக்கு அது ரொம்ப ஹெல்ப்ஃபுல்லாக இருந்துச்சு. தேங்க் ஃபார் ஹோப் ஃபவுண்டேஷன்.
Hi everyone, I am Dr. Nityanandan, Pulmonologist from Apollo Hospitals, Greens Road, Chennai. So I have now come to Apollo Hospitals in Vijayapuram, Andaman Nicobar Islands. So I would like to talk to you regarding certain topics regarding pulmonary medicine. So I come here once in 2 months to this Apollo clinic which is located in Vijayapuram. So our aim is to streamline services here, providing super specialty services, especially from my department, which is pulmonology. So where we do have facilities for doing pulmonary function testing, PFT. We have CT scans, and we do smoking cessation programs, and also here we do OP services every once in 2 months, for common ailments like asthma, COPD, and also for pneumonia and stuff. And if patients need advanced treatment in case of like bronchoscopy or intervention procedures, then obviously we offer them the chance to visit the branch in Chennai, so that and also we have good streamlined services for the people to coordinate between here and Chennai.
So what are the most common lung diseases you can see among patients today, and are respiratory illness becoming more common?
So in my practice, common ailments which I see are basically bronchial asthma, what in common person term you call it as allergic bronchitis, but we call as bronchial asthma. The second most common we see is COPD. And then we also see lung infections which vary from season to season, commonly viral infections, viral pneumonias, and bacterial pneumonias, tuberculosis. So we lot of things like that. And also we'll see non-infective conditions like interstitial lung disease, which is basically lung shrinkage. We see people with complaints of obesity, excessive snoring, sleep related issues, people coming with lung tumors, fluid in the lungs. So all sorts of stuff we see.
So what are the early warning signs of serious lung disease that people should never ignore?
See, as far as the respiratory system is concerned, so the most common symptoms I would say to people to be wary of are first is cough, second one is breathlessness, and third is wheezing, which is noisy breath, and fourth is chest pain. So these 4 symptoms anyone should be wary of. And these symptoms lasting for more than few days, so you need to be careful and to consult a specialist.
So how can people distinguish between a common cough and a potential serious respiratory condition?
So in general, what we say is any cough which lasts more than 2 weeks, so you need to get a consultation done, because common viral illnesses you catch, common colds, and those things also lead to cough. So those coughs usually subside over a period of 2 weeks. So any cough lasting more than 2 weeks, you need to be wary of it. Also, this is for the duration is concerned. Also, if you have a cough which is productive, meaning you're producing sputum which is yellowish and it's lasting for more than few days, if there is blood in the cough, or if the cough is associated with any breathing difficulty and the fever is not going away after a few days, obviously this cough needs to be taken, you need to get a specialist appointment.
What are the most important steps people can take to keep their lung healthy and prevent respiratory disease?
So first is to maintain a good healthy lifestyle, so which means taking proper 3 meals in a day at appropriate times. Second, to maintain a good body weight, so obviously you need to have 30 minutes of brisk walking daily. and avoiding smoking. So and maintaining a good indoor environment, which is as good as an outdoor environment. Also, people tend to forget that indoor pollution is also a very bad thing. So obviously you need to make sure your indoor environment is not musty, not much moisture inside. You need to have a good ventilation inside. Cross ventilation is important, at least some amount of sunlight exposure inside your home and outside in every day. It's very important. And most important, you need to get yourself vaccinated. So just like vaccination in children, we also have adult vaccination, which is recommended depending on your comorbidities and age categories. We obviously recommend adult vaccination for all people. So if you follow these steps, obviously you're going to have lesser chances of having any respiratory issues. Obviously also you need to be wary of all the respiratory symptoms which I have mentioned previously. So any of those symptoms you have, you should always get a consultant opinion.